Hi, on this episode of the Nurse Coach Duo, we're interviewing Dr. Rebbecca Hertel. She's a certified menopause practitioner, and we're discussing perimenopause. We talked to her about her own journey and how that encouraged her to dig into learning more about menopause and how to support women in this stage of life. We'll discuss everything from symptoms to things that we can do to help us feel better. We were so excited to have her on, and I think you'll find this conversation super valuable. Please don't forget to subscribe so that you don't miss our future episodes. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider. Hi, welcome to the Nurse Coach Duo. I am Coach Jen. I'm the owner of Clarity Health and Wellness Coaching.
And I'm Angie McGuire, the owner of Coach Angie. And today, we're so excited to talk with Dr. Rebbecca Hertel, who is a DO, and she is also a Menopause Society certified practitioner and board certified in osteopathic family medicine physician and certified menopause practitioner, and the founder and CEO of Osteopathic Midlife Health, a telemedicine practice dedicated to midlife and menopause care. With over 20 years of expertise, Dr. Hertel has provided compassionate, patient-centered care across all life stages since completing her residency in 2009. A passionate advocate for women's health, she is committed to advancing education and awareness about the unique changes women experience during perimenopause and menopause. Dr. Hertel regularly teaches medical students, and she educates colleagues to improve understanding and care in family medicine. Beyond her clinical work, she delivers menopause education to providers, students, and communities through lectures, panels, and podcasts. Dr. Hertel has a large social media presence on multiple platforms where she shares valuable insights, resources, and support to help women thrive in midlife and beyond. She is also the co-host and co-owner of the podcast, The Dusty Muffins. Yay! Welcome, Dr. Hertel.
Welcome.
Oh, thank you so much. I know that's so long, isn't it? Sorry about that. You could have shortened any of
Great.
That was a challenge. That was challenging, but it's good. That's great. We got to share all about you and celebrate
Oh, I
all of your
appreciate.
wonderfulness.
Thank
So it's
you.
great.
Oh, thank
Yeah.
you. Thanks for having me. This is wonderful. I really appreciate the time.
Yeah, thank you.
Yeah.
Super excited to talk to you.
Yeah,
Yeah.
me too.
Yeah.
Me too.
So when I feel like we should share a little bit how we met you and
Yes.
Jen and I went to the M Factor screening in Chicago, and we were lucky enough to sit down next to Dr. Hertel, or Jen was. And so we got to chatting and learned about you and Dusty Muffins and your practice that you have in Pennsylvania, and invited you on. And we're just so happy that you're here. And um, that was probably the best thing that happened to us that night, right, Jen, is meeting
Yeah,
Dr.
for
Earl.
sure.
The
Oh,
screening is awesome. And the panel was excellent too, of course.
oh
But
yeah.
yeah,
Yes, yes.
yeah,
And it's so funny how our worlds align because Pam and Julie are so wonderful. And
yes.
I was on the panel for their M Factor screening in December. And I'm licensed in Illinois. So when I went
Okay, yeah,
back, I
great.
thought, yeah. So when I went back, I was like, I'm going to go. I want to support my friends. I have friends that were on the panel. So I wanted to support them. I thought it could be
Yeah,
networking because I'm licensed in Illinois.
yeah.
And I also have a chiropractor friend and colleague too that I went and was adjusted before I
Nice.
know it was like a one-stop shop. I like saw her and I was like, oh my God, I don't know that I can even like go anywhere right now.
Right.
She's amazing and she's in Chicago as well. So yeah, it was really great. Met the two of you and that was just I'm telling you, the world's like aligned, the universe aligns and brings us all together for
Mhm.
just amazing networking and being able to help, more women we can help, which is so great.
Absolutely.
Yeah.
You can tell that, just see the passion for everybody at those
Hmm.
M factors. And I know whenever I sat and started talking with you, I could definitely see that. I know one of my first questions was, "Oh, do you work in Missouri?" Because I'm in Missouri. Angie's lucky enough to be in Illinois. So, it's just really cool to see that we have so many, mostly women, right, that are getting into this and
Hmm.
really making, like, helping out all of these patients, all of these thousands of women that are going through menopause and perimenopause and are just at a loss. So
Yeah.
maybe we can start there if you want to just tell us a little bit about, how you came to get into this area of women's
Yeah.
health and health, and how you're managing it with your company.
Yeah, yeah. So, I've done family medicine, I graduated residency in 2009. So I've been, a physician, I guess, for over 20 years now, and I think about that. But so I was doing family medicine forever, taking care of, from babies to end of life, delivering babies at 1.2 in my residency, and just decided that I couldn't do that. I was a single mom at the time. So, and three young kids. So it just wasn't conducive to like that lifestyle. So when all those years, did a lot of women's health. And I mean, my training was amazing in women's health. It really was, except for that part, which I didn't know. So I was definitely one of those clinicians that said, "Boy, this is just that part of life for you. Like, you're just going to have to learn how to manage that. And this is the transition, or let's put you on some antidepressants." And, because can honestly say I don't remember having any training except for the definition of menopause, right? When you stopped your periods, and we all are really excited about that. Yay, we don't have to have periods anymore, but was never taught anything else, right? Yeah.
Yeah.
And so it wasn't until my own, and I went through IVF with my last baby because and not because I had, well, in retrospect, I would have had fertility issues because my AMH was really low, but I had an Essure, so I wasn't able to have babies after my last child before this one. And so we went through IVF, and I remember the doctor telling me, like, you would have had to do IVF regardless. Like, my eggs weren't good, my supplies weren't good. I didn't get a lot of eggs. And that truthfully was probably around the time I had my first hot flash and really didn't realize what it was. So I think that muddied the water for the first 3 years. I had him right before I turned 40, and he's now 8. And so I think, with breastfeeding and all of those changes, I remember my moods being terrible, but I really just thought it was just like, I'm stressed, I have a new baby, I'm old, all of these things that you're feeling. And after all of that was done, I started just with even more mood disruptions. So, the week before my period, or they were starting to get really, really heavy, and ended up with an ablation. But then the brain fog set in. And that was probably my 43, 44. But I could not get through patient charts. I'm like reading patient charts over and over again. It's not sticking in my brain. I'm having terrible migraines. I'm not sleeping. Even the hot flashes and night sweats were terrible compared to the cognitive dysfunction that I was experiencing. That was devastating. And I mean, I was, just the sharpness, the ability to complete sentences, the ability to have sentences, the loss of words. So I really truly thought I was developing adult ADD. I thought I had a brain tumor, all the things. And I started just going down the rabbit hole of like, what is this? What's happening to me? And social media, like your phone listens to you, right? And so all of these things, and perimenopause popped up. So I actually sought out a telemedicine clinician, and she told me that she asked me if I wanted to go on birth control. And she told me that I just couldn't multitask anymore.
Ugh.
And I thought, well, that's not
Mm.
conducive to my life. And luckily, I did get some progesterone. So I did start sleeping. But I found another colleague who was doing actually functional medicine. And she was the first one that finally put me on an estradiol patch. And then I started, so it changed my life. And then I started taking every single course I could, everyone. And, and these are all courses that you have to pay for outside of, right? Outside of your education, because we're not educated at all. And that's how it happened. I started working with an online telemedicine business as kind of like a side gig. And I did that for almost a year and then decided just to launch on my own. And I did that January of this year.
Wow,
So
congratulations. It's
thank you.
awesome.
It's scary to do all that
Mm.
stuff. And,
Yeah,
to like, we're not taught how to be business people at
At
all,
all.
right? In medicine, we're not taught. I mean, we're not even taught how to build. That stuff like you learn later. There's no courses during, medical school and things like that on even how to bill. And so, those are all things that you're taught later, or you have to seek out, or you have to take courses. So same thing with any of this midlife health care. It's
hmm.
just you have to seek it out and hope that who you're getting it from is legitimate.
Right,
So,
right.
yeah.
So thinking about that first provider that you talked with, and they said that, they offered you birth control and that told you you can't multitask
Yeah.
anymore, which is wow, that's hard to hear. And you knew that that was like you weren't standing for that, right? You're like, no,
Right.
that's not going to be how it
Yeah.
is.
Thanks.
And we've heard all different stories, right? Like
Yeah.
what women are told and informed and get on with it or whatever. Just this is aging, this is the process.
Hmm.
What do you wish for your providers, more, what do you wish they understood more about menopause and perimenopause? I know we're strict, we're going to stay in this lane of perimenopause
Sure. I
because
think,
it is now becoming the hot topic, right?
yes.
Which it's
Yes.
in a
But
topic that has not been talked about less
you
than
got it.
menopause.
Yeah, yeah,
Anyway,
exactly.
yeah, yeah,
Exactly. It's kind of, and I think it's a lot because our millennials, our generation is starting to really, start some of this perimenopause. And so, they're
right.
just like, I don't know about that.
Hmm.
And so I think number one is that perimenopause is real. I mean, we cannot start to help these women if you as a clinician don't understand that it's real, that that these women, it's more than hot flashes and night sweats most of the time. In all honesty, that is not what brings perimenopausal patients to me.
Right.
What brings them to me is this cognitive dysfunction, the mood, and the mood change, anxiety, depression,
Hmm.
and this fatigue and brain fog. That because they're most of the time they're like, I can deal with a hot flash and a night sweat, but I can't do my job. I'm snapping at my kids, I'm snapping at my spouse. I can't get off the couch. And so that's probably the biggest thing is that A, it's for real. B, it's not hot flashes and night sweats,
Hmm.
and that it can be treated. And there's lots of tools in our little clutch bag, right? That we can use for perimenopausal patients.
Yeah, yeah, absolutely, because I think that is the hardest thing, not even just for providers, but for the patients themselves, is they don't know what it is, right?
Right.
And so
Right.
if you have a hot flash, you're like, I know what that is. I can, so it is easier to like, you can say, oh, well, I'm okay. But then, especially those, I mean, I don't want to say especially because somebody's probably handling other things more difficultly, but like the mental health, when it really starts to hit in and you're like,
Yeah.
I have nothing left,
Yeah.
right? Like I
Yep.
just can't function. I have nothing left. And you don't know why. You don't know why you can't sleep. And when you can't sleep, you can't eat right. And when you can't eat right, you don't, you're more stressed. And
That's
it's
right.
just this whole avalanche, snowball,
That's right.
whatever term you want to use, right? So you said there's a whole bunch of tools in the toolbox. Obviously, we all know about hormone therapy. We can get into it, if, eventually. But like, I would love to hear from you. Like, what are some of those tools? What are some of those things that these
Yeah.
women can start doing besides talking to their providers? But what can they start implementing to feel a little bit better?
Yeah, so some of even just the, lifestyle changes that they can do, because it's not just one thing, right? So, hormone therapy can be one piece of the puzzle, but if you're burning the candle at both ends and not taking care of yourself, because we live in such a guilt-ridden society about our kids and not, and I am such, if you talk to any of my children, I am a quality time mom. Like they know that if they get 10 minutes, a half hour with me, it is like that's what we're doing. And no one else is around. The phone is down, those types of things. And if it has to be with me, then I'm gonna say to them, you've got me. I have a phone here because just in case I have to answer something. So that's part of that. That part of that is the trying to kind of get out of that mom guilt, putting yourself to bed at a time where you're not scrolling an hour or two before bedtime. Because we know those phones, those computers, our TV makes our brain feel awake, right? Increases that cortisol, that awake, like when we wake up in the morning and have the sun coming through the shades, all of those things. So I tell them, put the phone away, stop scrolling. I mean, I'm not good at it either. I should practice what I preach, but sometimes it's my only time. Um, but in all reality, going to bed earlier, getting yourself to sleep, and we can kind of talk about if they're not sleeping and some other reasons why. Make sure that you're eating clean, healthy foods, right? If you are prioritizing your protein, your fruits, your vegetables, you're hydrating, 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 hydrating. We underestimate the amount of water you should be drinking every single day. Um, so we talk a lot about what just really good foods, whether it's a more of a Mediterranean diet, anti-inflammatory diet, low sugar. Some women learn that they have to stay away from dairy because that's inflammatory. So we talk about that. And we talk about exercising too. Even if it's a walk every day, it's something. The studies are incredible, even just on Alzheimer's prevention with physical activity. So I use
Mhm.
that a lot. Like, let's just start with just walking, but that should be incorporated into your everyday routine and bring your kids with you. They need to do this stuff
Yeah.
too, you know? And so that's kind of where we start as far as things that you can do and mindfulness, stretching, yoga, meditation, going getting your hair done without anybody else, going and, getting your nails done without anybody else. So, those types of things we definitely start with.
Yeah. And also just going back to the hormone therapy during perimenopause, just as that is one of the tools that we can use,
Yeah.
is, I hear from clients, I hear from friends that, my doctor, my provider won't put me on anything because I'm still bleeding. I'm still having a period. And so can you just talk a minute on that, and how
Yeah.
you move forward with that?
Yeah, yeah, absolutely. I hear it all the time. I'm still having periods. That means that they can't do anything except if I want a birth control pill. Um, or I can't be because I'm having periods. And so that is one of the biggest misconceptions that clinicians who are not trained in menopause, and even some of your certified menopause clinicians. So I always say, make sure that you're asking before you go and book those appointments, kind of how they deal with perimenopause, if that's what you're looking for, because not everyone is comfortable doing it. But that being said, use anything that we use for menopausal hormone therapy, we can use in perimenopause as well. So for some women, I actually saw someone today who we had to shut her ovaries down. She just was not doing well on menopausal hormone therapy. So we decided to go back and we ended up doing a progesterone only pill and that shut her ovaries down. And she looked great. I mean, she was wonderful. It was a night and day. So
Mm, great
sometimes we
story.
do have to shut. Yeah, yes.
Yeah.
And this was someone whose mental health was suffering tremendously. I was very worried. So I also want to say that these types of birth control pills, because they are contraception level, those can be really important and we can use them if we need to. And for some women, they need birth control because in perimenopause you can get pregnant.
Right.
So if they're not using an IUD, then they need and they don't want to get pregnant. And sometimes that is a really great way, and they can use it, and they can use it until the average age of menopause, and then we can switch them over. So that is one option. But certainly, a lot of times in these women, I just start with progesterone. They're not sleeping, and their mood is terrible. So we'll start some micronized progesterone at night because that is typically the hormone that decreases first anyway. That's why they're having some fluctuations in their periods. And a lot of times they do quite well. They come back, they're like, my hot flashes and night sweats are gone because that also helps with that. And I'm sleeping and all is well. They may come back a month later.
Yeah.
And
Something
sometimes I
else.
have to take them off, right? Sometimes I've
Yeah.
put them on these medicines and then all of a sudden their ovaries start behaving and I have taken them off of everything. And then
Right.
they feel a lot better. So the main thing I want women to understand in perimenopause is A, give yourself some grace. B, you are truly on a hormonal roller coaster that's out of control. That what we start with may not be what we end with, and we may have to take you off of everything. So, and that's okay. All of those options are correct.
Yeah.
Yeah. I
Yeah.
love all that. And I thank you for saying that you can start on progesterone only.
Yes.
And also, you know, that it's management. It needs to be
Yeah.
managed
Yes.
and follow up. And,
Yeah. It's
you
so
know,
important.
the patient, the client has to be 100% in as you already
Yeah.
are, so
Yes.
it's important for them to know too. It's, they
It
have to come
is.
back and follow up as well.
It
So
is, and it's hard because there's so much on social media, and a lot of times they're hearing you need more estrogen, you need more
Yep.
estrogen, or you need more, you need more. And so it can be difficult because they're coming back to you. I still feel this way, I still feel this way. And we really have to explain and work with our patients to say, listen, high estrogen can make you feel just as lousy, if not more, like low estrogen. You are bloated, your breasts are tender, you're moody, you're crying. As a matter of fact, the patient that I was telling you about that I had just put on an oral progesterone only, we completely took off her estrogen. She goes, every time I put it on, I start crying. I'm like, take it off. Don't use
Yep.
it. We have time. So
we have
I think,
time. I love that.
yeah, we have time. We really do. And it's hard because you've been feeling miserable and you want to fix menopausal hormone therapy, perimenopausal midlife health, and this is not a quick fix. And
Yep.
so give yourself grace, work with your clinician, and I think just know that it's going to take some time because I don't know what those ovaries are doing, man. They're having a great day in the pool, jumping around, splashing around, causing havoc, doing whatever it is that they
Right.
want.
Yeah. Yeah, I mean it's highly individualized, right? Like I mean everybody
So
wants
nuanced.
kind of like this. You go to the doctor, you've got asthma, you get this pill. You go to the doctor, you have
Yes.
whatever, diagnosis, treat.
Yes.
Everybody wants that. And I find that the women that I talk
Hmm.
to, they also that the diagnosis to them is so important. Am I in perimenopause? Am I in perimenopause?
Yes.
And I just say, look, if you're over 40, you're in it, first of
Sounds
all,
like it.
right? Whether you have symptoms or
Yes,
not,
Yes.
whether you have
probably.
symptoms or not, but yeah, let's
Yes.
let's dig in and figure out whether this is
Yeah.
perimenopause or not, right? Like
Yes.
you're like, is that what the symptom is related to? Because it could be other things, right? So, you
Oh,
hear these
yes. The
horrible
low-hanging fruit.
stories. Yeah. You hear these horrible stories about people like, I went to 8 different doctors and nobody once said perimenopause. That the problem there is that nobody once said perimenopause. You might need to go see those other specialists to make
Yes.
sure that it's nothing else.
Yes.
So maybe if you could,
Yes.
I know we're almost backing up the bus a little bit, and I feel like Angie, we're almost doing that with this interview because we just jumped right into symptoms in our
Yeah.
podcasts and just talking about all the different things you can do. But maybe let's back it up a little bit and say, how do we know if our symptoms are perimenopause? Are there labs?
Yeah.
What do we do? All that, what happens?
Yes. Yes, I actually did a consult call last night with a woman that was asking me that too. And we were talking. I said, "Well, have you had any other labs?" And she's like, "Yeah, I have low vitamin D and B12." And I said, "Okay, well, if you're feeling fatigued and achy, this is what I would do." I said, "You're almost 40. You probably are in perimenopause, or if you're not, it's going to be happening soon. But let's talk about that low-hanging fruit, right?
Yes.
Iron deficiency, common in perimenopausal women, in women in general, especially your female athletes, right, that are runners and things like that too. Or, if you, depending on your diet as well. So, vitamin D, I mean, I'm here in Pennsylvania. Everybody here is vitamin D deficient, probably where you all are too, right? We're just too far away from the equator. We don't get enough sun. So, everyone here is. So, iron, your vitamin D, your B12, those for sure. And then I always make sure I have a thyroid too. So, those are at least the four things that I'm going to say to you when you come to me. Have you had them done? If not, you should. If you're regular PCP, and I think sometimes that's where it's nice where, I have this family medicine background, I think about those things and I'm checking them and I'm going to fix that stuff first. And truthfully, sometimes I find severely iron deficient women and we fix their iron and they're like, later. I feel great. And I'm like, okay, come back when you need me, or whatever. If they want to go back to their PCP to manage that, that's perfectly fine. And then I am here to support them when they're ready. So
Mhm.
fixing those, like we say, that low-hanging fruit first, because you can also almost get not focused, hyper focused on is this perimenopause, and then you miss some of those really other important things, and we don't want to do that. So same thing with palpitations. There's nothing wrong with checking some other things, inflammatory markers, or, for joint pain. I mean, I live in a place where Lyme's disease is everywhere. So that may be something that I would choose to check in an area and roll that out too if their PCP hasn't done that. So there are other things that we need to think about. Then we can go back and say, okay, so do we do some hormones in perimenopause? Sure, why not? If it looks normal, it's probably perimenopause. But boy, they love to see it. And
Yes.
sometimes I do
Hmm.
too. Because if I find an estrogen of like 600 or 700, I'm like, no wonder you feel like crap. You're in a
Yeah.
loop cycle, you feel terrible. So it can be helpful because I usually would like to do like an FSH, an estradiol level, and then a testosterone. Because if we're going to look at that, I might as well look at all of them. And then women feel validated. If your FSH is under 25, you're perimenopausal, right? And sometimes I've had women where it looks like it's menopause, and then I'm like, oh, maybe we should check that because that sounds weird. Dang it. Nope, not quite yet. So it happens. So ovaries are just funny little things and they do their own thing.
That they
Yeah.
do.
Yeah. I mean, I think, it's so great to find a provider like you too that will work with you. And, if you want labs, if it's really important for you, okay, let's draw labs.
Yeah.
Is it necessary all the time? No, I'm talking about hormonal labs, but I love the fact that
Yes.
you're checking those four things first too, right?
Yeah. Yeah.
And the fact that have so much, experience in family. It's such a great combination that you bring
Yeah.
to your patients. The full understanding, right,
Yeah.
of it
Yeah.
all. So,
Yeah. It really is
can
helpful.
you just because before I got into this world, I didn't really understand, and I'll probably understand it even a little bit more after you this question. But we talk about this emotional roller coaster that we're on. Um, the zone of chaos, as it's termed by
Yes.
Dr.
Yes.
Haber. Just is that kind of correlates with the loop cycle? Loop cycle, I wasn't
Yep.
really familiar with. I just never didn't learn about
Yeah.
that. I missed it
Yeah.
along the way.
Neither did I.
Who
Yeah.
did?
Don't
So
feel
could
bad.
you talk about the loop cycle?
Yeah.
Because I feel like there's people talking about it a little bit more out there and on different platforms and social media. And
Yeah.
if you could just talk on that for a minute.
Yeah, yeah, absolutely. And so what happens is that you have hormones that tell your brain. So, when you go to ovulate, your brain is sensing low estrogen. It sends, those chemicals and those hormones down to say, and that FSH to be like, hey, I need some more estrogen. So that follicle starts and the estrogen rises and then you ovulate. And so, and then if you don't get pregnant, then that is where progesterone, after that corpus luteum, after you ovulate, gives you progesterone. And then if you're not getting pregnant, it goes back down, you have your period. Well, when you're in perimenopause, particularly in late, you start to run out of follicles. Running out of follicles means that you're running out of estrogen, and the brain is like, hey, I need more estrogen. Your ovaries are like, I really don't have enough eggs to give you. Your brain's like, that's not cool. I need more estrogen. And so it's sending these signals and sending these signals.
Mm.
And then all of a sudden, you are getting these big signals. And then you get this big surge. You ovulate, pushes it out. You get this big surge of estradiol. It's the easiest way. And sometimes that can be on one cycle after another. So, like you give one, it's not enough estrogen. So your brain's like, no, 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 we're going to do this again. And then you get one on top of the other. And I have seen, I probably the highest estradiol I have seen was darn near 700. And I like freaked out for half a second. And I was like, oh my gosh, does she have a tumor somewhere?
Mm.
And
Yeah.
and I don't know that that was necessarily the wrong thing because what if I would have missed that? But if
Mhm.
you check 10 days later, it was back down to normal. And sure enough, it was back down to normal. But boy, was she miserable. And they're miserable. They're ragey, they're headaches and they're not sleeping and their anxiety and their palpitations and they just feel awful. And so that's what happens is that the brain is sensing low estrogen and it takes all of the estrogen that it can get before anything else gets it, right? Our brain is real stingy. And so it keeps sending signals down to ovulate because it needs estrogen. And then that's what happens is finally the ovary is like, "Ugh, okay, I got one more for you." So,
Yeah.
and
Oh,
then
we
you get
work
those
so
higher.
hard.
We
They
do. Our
do.
poor
So if you
bodies.
think about that, if you think, and I wish if I would have thought about it, I would have grabbed my graph there. But if you think about kind of, that up and down of ovulation, the estrogen starts to go up and then it goes back down. Well, you get another one on top of that. And then you can even get another one on top of that. And so
Yeah.
you're just not feeling great at all. And it
Yeah.
happens a little bit more, like I said, as you're getting in late to peri because you really are running out of eggs and
Yeah.
the brain is like, this is not cool.
Yeah. It's a great explanation because I think that so many
Yes.
people just think it's just this simple thing of our eggs just start to not produce enough
Yeah.
estrogen and all of a sudden, and like, you've seen it actually drawn on things like it's a cliff and it's like, no, there's no cliff,
Yeah.
but only if it's surgical, right? Like we kind of go all over
Yeah.
the place. And,
Yeah.
I mean, just
And then
in,
and then it can be a cliff, right? It
right,
all of a sudden goes
eventually,
Yeah.
all,
right.
and then it's like boom. When I
hmm
then you never have one again, and you're like, holy cow, what just
Yeah,
happened?
where did that happen? Yeah, where did
Yeah.
that come from? And
Yeah.
like all of these things that we've talked about, like there's just so much to it. Like people want to just kind of oversimplify it. Yeah, I don't know why that keeps happening to women, right? Like, oh, well, you're having period cramps, you're just gonna have to deal with it or whatever. Let's just oversimplify it. It's
Yes.
one little hormone. First of all, it's way more than one hormone. And there's,
Yes.
as we've already
Yes.
discussed, so much to it. So I think that people, like all three of us are obviously doing something right this second, trying to educate people, right? There's so
Yeah.
much information out there. We're trying to say, hey, let's get the right people to listen to,
Yeah.
right? And so you have started an awesome podcast with three other providers. So tell us a little bit about the
Yes.
Dusty Muffins.
Yes, and how, oh my gosh, yes, my minnow besties for sure. So we met taking a course together. Um, and so we were all certified practitioners. We took advanced courses and we actually were working in the same telemedicine practice. And so we, just started that way. That's how our friendship began. We did at the Menopause Society, we actually did a poster presentation together and just had been friends. And so when we all at different times decided to launch our own individual practices and private practices. And when we did that, we were talking every day and giving each other different what works for you, what doesn't work for you, sharing things. And we're like, you want to start a podcast? Like funsies, if we didn't have like other things that we were already doing.
Right.
And that's how it came. And so it's interesting. So we're, sitting around trying to figure out what to name ourselves, and our friend Christine, her husband's like, y'all should be the Dusty Muffins. And he's a huge Saturday Night Live fan. And Christine's like, and we were like, yes.
Yes.
100% we are going to do that. And so
Love it.
and so that's how we were born and we just have the best time with it, we love just chit-chatting amongst ourselves, or if we bring guests on, that's always just really a great time. And like you guys are doing, it's trying to get as much education out there for women because
Mhm.
half of the battle is that they just don't know what's going on. They don't know that they need you. They don't know that they need me, right?
Yeah.
So, and or anyone, whoever that is, and how to find somebody because there's just not many of us in perimenopause and menopause, and certainly the clinicians that prescribe, there's I think now 3,000 of us, so
Wow.
which is great. It is growing, but
Yeah.
still, I mean,
Not
that's
enough.
one. No, yeah, there's one practitioner per what, 32,000 women. It's
Insane.
maybe a little bit less now, but I mean, I don't have that many patients. So, and nor could anybody.
Right.
Right.
So,
Right.
yeah, we definitely need more for sure. And we just need to educate starting in, nursing schools and medical schools and PA schools. And, it needs to start there. So when I have med students, we talk about it. My daughter's in medical school and she probably got an hour, although it was good. I looked at the lecture. I was very impressed at least,
Good.
but it was an hour. That's it.
Right.
For half the population. Sad.
Correct.
Yeah.
Yeah.
51%, right? Yeah.
Ridiculous.
Not enough. Not enough.
Yeah. So on that note, you started the osteopathic midlife
Yeah.
health telehealth
Yes.
platform of seeing patients, and
Yes.
we'll put this on our in our notes. But you see patients. You can see patients in multiple states, right? I mean, we already
Yes.
mentioned Illinois, not Missouri.
Yes.
Sorry, Jen.
Yes.
You have
Yes.
to.
But I can get you
um,
someone in Missouri though. I do know. I do have people.
Good.
yeah, right. So we'll put those list of
Great.
dates on there on our notes, which is that's awesome. So we I think, women in midlife, in perimenopause, menopause, you see this like thriving through midlife. Like what does that mean? So like personally and professionally, what does thriving in midlife mean to you?
Yes. Yes. So it really, you know, I was looking at that and I thought, I tell my women all the time, this is how you thrive in midlife, meaning like this is how you are feeling strong in your body, in your mind, in your body. We're not letting perimenopause and menopause take us over. It's not writing our story. You're owning your own story. You're taking that back. You still can do all of the things that you want to do. You're going to be confident in your choices, confident, in 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 all aspects of your life. It's not being about being perfect. Nobody's perfect, right? But it's more just about being aligned with yourself. And for me, myself, it's helping those women feel that way and live more, more boldly, not fading into the background and not and to take ownership and to take control of their midlife and whatever it is that they want to do for the next 30 plus years. So,
Yeah,
Yeah.
I love take control. That's a perfect
yes,
analogy because we can take control of this, right? Like, and
yes,
and I
yes.
think that the women in our generation right now are trying to because they are screaming at the rooftops.
Listen,
Hell no,
Yeah,
we ain't
Gen
standing
X is
for it.
something to be, no, we won't.
We're not standing for it.
I'm like, Gen Xers are a force to be reckoned with, that's for
Yes.
sure.
Yeah, absolutely. Absolutely. Well, this has been amazing. And, I hate to cut it off because there's so
Mhm.
much more we could talk about. I mean, this is an endless topic and you're so
Yeah,
informational. I really appreciate that. But,
thank
if,
you.
is there if you have one piece of advice to give women, I mean, I know you're talking about the control and like give yourself some grace and all of that, but
Yeah.
just, these women who are kind of going into perimenopause, starting to feel lost, starting to feel like, they don't know themselves and nobody's helping, right? And that they're not
Yeah.
getting, they don't have amazing people like you to touch base with, unfortunately. Like what kind of advice would you give them to get themselves feeling a little bit better?
Yeah. So, there's first of all, own it. Know that you're not crazy. That this is truly something that you're going through, that this is your body changing. So, recognize that part. There are a lot of free um, information on the social media as long as you're listening to the right ones. You have to be really careful. Of course, the Menopause Society can be a great resource also to look for people that are near you. They have telemed platforms as well if there's not anyone local. So as far as getting women, there's wonderful podcasts as well that can help. So there's a lot of like really great free resources that a lot of us do to give back to women that we can't help, that aren't in our states, or that
Yeah.
they can't come to see us. But in addition to that, I think women too need to understand that this isn't the end of something. It's really the beginning. It's the beginning of the next stage, right? That you're wiser, you're stronger, you can be more grounded than you ever have been. I mean, this, we've never felt so strong in who we are as a woman, as a female, than I think this part of our life, right? There, I don't I wouldn't wish to go back to any of those like 20s, 30s, none of that. So I think with the right support for sure, that women, really midlife can be more of a launch pad and not a breakdown.
Yeah.
Yeah.
Beautiful.
That's awesome. And I think, to go back to the M factor, the night that we met you and that the night that Julie and Pam hosted, and the feeling of all the providers in the room, practitioners of all sorts, coming together really to advocate for women and
Yes.
educate and support, and just for our listeners to know that people are working hard and,
Yes.
find the right people. I mean, this is what Jen and I, as nurse coaches, sort of specializing in this area of working with women in midlife, you know, there's all sorts of providers out there, but find the right
Yeah.
people, of course. But just
Yes.
there's there's a lot of good stuff going on. So,
Yeah.
and
No,
thank you
there
so
is.
much for being with us today. It was really incredible. Thank you.
Absolutely. Thank you. I really, really enjoyed it. I appreciate you asking.
Yeah, absolutely. Well, we just want to one last time say thank you and for sharing your story and all your insights with us. I know our audience is going to think this is just fantastic and probably request you to come back. So
Yeah.
hopefully we can do
Absolutely.
that. And so
Yes.
please, if you're listening and you like this, subscribe, add comments so that you don't miss future episodes when we continue to tackle menopause symptoms, solutions that you can actually use and give you that information that you need. So thank you so much for tuning in and have a great day.